My name is Louis Wetstein, and I'm a thoracic and cardiovascular surgeon. Over 40 years ago, I had the great fortune to be hired by Dr. Alden H. Harken at the University of Pennsylvania. Dr. Harken, at the University of Pennsylvania, you developed a surgical technique for a heretofore refractory medical problem, which is malignant ventricular tachyarrhythmias, which was extremely successful. How did you get involved in that type of surgery?
That was another extraordinarily moment of good fortune for me. I arrived at the University of Pennsylvania as the most junior cardiac surgeon or most junior faculty member, and I met the most junior cardiology assistant professor, Mark Josephson, and Lenny Horowitz. And they were doing what a cardiologist in the Netherlands had done. There in the mid-70s, he had developed a strategy of pacing patients into stable ventricular tachyarrhythmias. These were patients who'd all had a sudden cardiac death episode out of the hospital and been resuscitated. But the Heinwellens had no therapy other than drugs. When he discharged somebody with persistent inducible ventricular tachycardia, those patients had an 80% one-year mortality. Mark and I thought maybe if he could induce ventricular tachycardia in the operating room, we might be able to, with a bipolar electrode, cover the epicardial surface of the heart, then through a myocardial infarction, and all these folks had had previous myocardial infarctions, make a ventricular incision and then map the inside of the heart. We were able pretty consistently, like very consistently, to find the earliest area of activation came from inside the heart. Thus, the subsequent catheter ablation techniques that have now become common became possible. We excised that area of the inside of the heart, which Time magazine subsequently called the Pennsylvania Peel, and we had about a 9% 30-day mortality. Had another 9% mortality in the next 11 months. And so for that 300 patients about, we were able to convert an 80% one-year mortality to an 80% one-year survival. That really started my cardiac surgical career, academic career.
Well, I'm delighted to introduce Dr. Gene Moore, Distinguished Professor of Surgery at the Ernest E. Moore Shock Trauma Center at the University of Colorado. How do you feel he played a role in your academic career?
Alden Harken was pivotal in my career, as he was in many others, in many fronts. Research being just the tip of the iceberg, but he sat down with me and re-outlined my entire approach to research and a plan to get NIH funding, and it completely revolutionized how I approached research. He was just that kind of person who, so in terms of the research specifically, he again came down to the Denver General Hospital within the first week he was here, and then he was down here every week. Going, within 6 years we had NIH funding, and we've had it ever since.
What do you think is the most unique factor about Dr. Harken?
He's the most energetic person I've ever seen. But secondly, and very aligned to that, he's probably the most generous person I've ever seen.
I'd like to introduce Dr. Lucy Obu-Wobadu, a resident in psychiatry at the Mass General in Boston. Good morning, Lucy.
Hi, thank you so much for having me.
What has your relationship to Dr. Harken meant to you?
I can't even, put it in words. There's so many dimensions to how much Dr. Harken has meant to my life. It has meant having I get emotional thinking about it because and most importantly, he has modeled to me what it means to be a compassionate human being and physician, that despite all of his accolades, despite all the attainments that he's achieved in his professional life, he greets everyone that he meets with the same humility and the same warmth across all different fields. I've seen him engage with the janitorial services team as if they were the chiefs of surgery at UCSF. He knew their kids' name, where they went to school. He would just greet everyone as if there was no hierarchical differences. And that's not always seen in medicine. Medicine has notoriously been one of status, of pedigree, and Dr. Harken may have all the papers to, all the pedigrees to prove, his excellence, but yet he has never let that factor into how he deals with his patients, his colleagues, and his community. And if I can be half the person that he has been in the medical community in mentoring people, I know that I would have had a life well lived.
It's a pleasure for me today to introduce Professor Sir Murray Brennan, Professor and Chairman Emeritus of the Memorial Sloan Kettering Cancer Center. Good morning, Dr. Brennan. Dr. Brennan, when and where did you meet Dr. Harken?
Well, we started out together as residents at the Brigham and Women's. My first rotation with Alden was at the West Roxbury. He was the chief resident. Stephen Rosenberg was the senior. I was the junior. And the intern was a Rhodes Scholar, Mort Khan, who was at least as smart as all of us.
What was it like training with Dr. Harken?
Well, as you know, his enthusiasm is unbounded. Non-stop energy, unbridled energy, I guess is the right answer.
What do you think is Alden's most laudable trait?
I mean, you can't stop him. And part of that is his ability to inspire young people, to really make people think it makes a difference to be an academic surgeon. So the translation of his natural enthusiasm into the ability to inspire young people, I think, is probably the most important thing.
So you did your surgical training at the University of Colorado with him?
That's right. So I came and showed up in June of 1991. I spent a full 10 years training with Dr. Harken because I trained as a general surgery resident for 5. I was in his lab 2 years as one of his NIH-sponsored. He had a T32 training grant with 2 funded spots for surgery residents. I had one of those spots. So 2 years in the laboratory, and then I spent 3 years as a cardiothoracic trainee with Dr. Harken too as well. So the full gamut. And we wrote what was actually one of the first papers kind of correlating a lack of ability, if you will, to kind of protect human muscle on patients who had been exposed to these agents. And of course, this is the same time there was some question about them contributing to excess cardiovascular mortality. He figured this out. I didn't. But I received all the credit for it. And to this day, Dr. Harken will tell people, Joe was in the lab. He was the first ever to figure out this connection. And I said, but in very much classic Dr. Harken fashion, he then stepped back and pushed me in the limelight and said, no, this is the person who made the observation. And that's telling of him in his entire relationship with, I think, anybody that's ever interacted with him. He is always willing to promote you, step back, not take credit, and it's rare in academic surgery circles that happens.
I'd like to introduce Dr. Glenn Whitman, who's professor of surgery at Johns Hopkins University Hospital in Maryland. Dr. Whitman, how did you first meet Dr. Harken?
Lou, let me first tell you what a pleasure it is to have the opportunity. This man has meant so much to me, as well as so many surgeons and people in the world. And being able to honor him is clearly is a privilege for me. I was so attracted to him that I went to him intermittently for advice. By the way, I wanted to be an orthopedist as the years went by, even up through the last year in medical school. But then I became an intern there at the University of Pennsylvania. And it was during the first few months when I did a rotation on cardiac, and I will never forget, he started talking about preload, afterload, contractility, and how coming off pump was he was teaching everybody, by the way, from the assistance side of the table, about what was going on then as we were coming off pump and filling up the heart and managing preload, afterload, and inotropes. And he had everybody at the table put his hand on the heart when it was empty and when it was full. And I remember walking away from that experience saying, maybe I don't want to be an orthopedist. Maybe I want to be a heart surgeon. And as importantly, or perhaps the whole reason, because I want to be like Alden Harken. It took me around 30 seconds to say, yep, I'm coming.
You were never concerned? There was never any concern about giving up a well-respected, established program at the University of Pennsylvania and gambling on going out to Colorado?
Lou, as you know, that's no gamble. Following Harken anywhere is not a gamble. I got an R29, but this was all scripted by Dr. Harken, and he knew what he wanted for those residents who were training under him, and he created a path for each one of us. And we didn't have to be the cardiac residents. Really, he was the chairman of surgery, and he took care of each one of us who graduated. There were 5 each year, and I just was one of the group that he really paved the way for. But I wasn't shown any favoritism. I was just given these opportunities. And
when you finished your training with him, did he continue to support you? Did you maintain that relationship with him?
Yeah, it did. He led me through the NIH and merit review VA process. I got a merit review immediately because of Dr. Harken, and thankfully so.
Finally, I mean, you also had a great surgical career. What do you think is so unique about Dr. Harken?
There are 3 things that I think are absolutely unique about Dr. Harken. The first is that he viewed his role as a surgeon not just as a technical role or as an educational role, but as a support for the families of the patients he operated on. I think that almost was his most important mission as a doctor. It wasn't to do perfect cardiac surgical procedures, although he did, and it wasn't to constantly teach, although he did.
Alden, if you would reflect back, what makes you most proud?
I have been extraordinarily fortunate, and every time there was a possible Y in the road, I've always gotten the break that made it easy. But I do believe, and I came across a book last year by a guy named David Brooks. And he wrote about the second mountain. And he describes the first mountain that we all try to ascend, and that's personal resume building, in which we try to achieve the goals that our culture thinks is reputable. At the end of that time, some of us look around and say, after we've tasted this success, what else can we do? And we recognize that you can dig down deeper into a journey that transcends that first mountain, in which you learn that collaboration with others and working with others, which is easy to do in surgery because there's so many people that are so capable, and working with others makes it vastly more gratifying. That second mountain has been the most gratifying part of my career and life, and I've been able to participate in the various phases of other people's climbing that mountain. And in doing so, we've accomplished some things that I'm proud of, but it's the working with other people that made it valuable.
If you look back on your career, if you had the opportunity to do anything over again, what would you do?
Oh, I'd do it all over again. I loved every minute of it. As I've said before, the luckiest people in the world are people that are doing something that they think is important and everybody else thinks is important. My parents inculcated the concept of education being everything. It's something nobody can ever take away from you. And so I do over working with all the wonderful people that I've worked with that have made me look so good, and I've tried to make them look good, and the reflected glory of this kind of collaboration has been the best part of my life.
No changes.
No changes.